It's noon Pacific. Well, thank you all very much for attending. And thank you, Dr. Boles, for joining us and speaking today on dietary supplementation in autism as informed by the latest science. So in addition to nutrition, Dr. Boles is going to be sharing exciting new data on genetic testing with his patients, the science behind it all, and how often was the underlying genetic cause clearly identified and in which patients, and how did genetic testing results change the disease management and supplementation. So today's presentation is scheduled to last approximately 30 minutes. We're allowing for questions for Dr. Boles. Please submit your questions in the chat and we can ask them. We'll also be asking questions periodically if there's any confusion. So to begin, I'd like to introduce myself. My name is Chris Manthis. I'm the CEO and co-founder of NeuroNeeds. I will be moderating today's conversation with my colleague, Kimberly Ruckman. Kim?
Hi, I'm Kim. I do NeuroNeeds social media, and I've also been a parent in the autism community. So yeah, I'm here to help with any questions that you might have.
And Dr. Boles, a brief introduction, and then we can get started.
Well, I'm a pediatrician and a geneticist. I see patients that are adults, young adults and children. About half the patients I see have autism or a similar diagnosis. I see people with a lot of other problems as well. Through DNA testing, I see older adults too. And I have done research for 20 years at USC and Children's Hospital, and I'm also one of the co-founders of NeuroNeeds, in which I take the latest in science and try to translate that into effective therapies for kids and adults with neurological disorders, in particular for autism.
Okay, well, thank you. Thanks again for joining us and for sharing your wisdom and your knowledge and your data with us. So I guess I'll hand over the controls over to you, Dr. Boles.
Well, I'm going to go over some cases because I think that, for medical training and when I talk to parents, they like to hear about real kids, or in some cases adults, with the disease, and said, well, how did you figure out what it is, and how did that information inform on how you treat it, and well, what happened? And so I'm going to try to answer those questions as much as possible. First one I'm going to talk about, I just spoke to her. She says that I can use her name, Emma. And she is now, I think, 14 or 15. She presented to me about a year and a half ago or so at age 13. She had a developmental regression in the first grade, and she was given an autism diagnosis, which was never totally typical, as it often is, and maybe half the patients have sort of, well, it looks like autism, we're not sure exactly. She had some auditory and visual processing delays, but she was doing fairly well until she got a common cold virus at age 12. Within one day, she lost all of her academic skills. So she went from basically doing algebra to not being able to add simple math. She regressed in her behavior, became almost catatonic. That would be like an infant in terms of her behavior. She started having these weird seizure-like events, but the EEG never showed anything. And so she also had migraine, chronic pain everywhere, chronic fatigue, POTS, dizziness. And then she had frequent infections, and she was treated with a whole lot of things regarding that, including IVIG and high-dose steroids. Now, these headaches were prolonged episodes with headache, confusion, ataxia, that's like a drunk would walk or a baby, and other signs and symptoms, including weakness was more on one side than the other. This was really diagnostic of hemiplegic migraine. Hemiplegic migraine can be caused by mutations in 3 different genes. And she had a mutation in all 3 of those genes, and these are her mutations down below towards the bottom of that. So the diagnosis is due to a calcium channelopathy. A calcium channel, which allows calcium to get into cells, is leaking, and calcium gets in too much. And so the diagnosis allowed to mitochondrial cocktail that is, we'll talk about that more in detail later, is basically large numbers of vitamins, antioxidants, minerals, etc., to boost the mitochondria and to detoxify, plus potassium chloride and a drug called acetazolamide. And on that treatment, she had dramatic recovery. In February of 2020, her academics was at the kindergarten level. It had been lower at times, and her reading was at first grade. That's what was tested at school. A year later on treatment, her reading had gone to the 8th grade level. She was in the 8th grade, and her math was at the 7th grade level. So she had dramatically improved back to her previous baseline. Her behavior became age appropriate, became an average middle school student. She was walking normal, and she still's got a little bit of pain and fatigue, and we're working on that, but she's like 99% better than she was before.
So, Dr. Boles, every time I hear you speak, you usually start out with case reports and real patients. And in most of these cases, you show that there are treatment how often are these how often do these sound treatment outcomes occur?
Well, I mean, obviously, I'm going to start off with one of the better cases, but I would say that the vast majority have some improvement. The improvement can vary between, well, in some cases, none. I'll show a case of that. And in some cases, it can be dramatic, like in this one. Profound recovery, like in this case, are not that rare. They're certainly not common, but they're not that rare. Most cases have a significant improvement, moderate to highly significant improvement. That's a very good question, is how much can you expect? If you find the diagnosis and treat it, oftentimes that the patient can remarkably get better.
Thank you.
We did the introduction beforehand. I just want to say here that, I consider myself a physician. That's what I've done most for the last 25 years or so. But I'm also a researcher. I'm still writing papers on, in particular, what the cause of autism is, and that I help design therapies for these conditions. And so I wear many different hats, and so I'm going to be looking at this from many different angles. And I mean, I'm going to be talking about things that have changed very, very recently, dramatically, and the literature really can't keep up with it. And so, first of all, is that personalized medicine is different in everybody. You figure out what the problem is in somebody, you treat it. That's not something that's been done in a double-blind study that's FDA approved and everything. So I'm going to be talking about therapies which are not approved by the FDA for these things, and also that there's an inherent conflict of interest in that I'm making and selling and profiting from treatments that we're going to be talking about. So here's the machine, the $1 million machine, no exaggeration. It's about the size of 2 refrigerators next to each other that actually does the sequencing. And the amount that we sequenced 5 years ago in my routine patients was literally 1,000 times less than what I sequence today in my patients. Today I sequence all of the DNA in my patients. And over the last several years, the amount of DNA that sequence, the sequencing accuracy, computing power, algorithms, cases reported, and our understanding of the biology has improved so dramatically that it's really hard to say, well, how often do you make a diagnosis? How often do you get a treatment? Because it just keeps improving month by month. But since the last algorithm that I got good at in the fall of 2021, it's been stable the last 7.5 months, I would say. And so I'm going to be showing you a bunch of the last 20 cases of kids with autism that I've looked at under the last 7.5 months. So,
all right. So Dr. Boles, just one quick question. I know that, we talk about this is a presentation on dietary supplementation, but you're using genetic sequencing to collect data on how you can best use supplementation based on that individual. Is that how we're supposed to understand this?
Well, yes and no. There are 2 aspects of the genetic information. One is, what is autism in general? What are the pathways that cause autism? So what treatments would you put in something that's aimed for people with autism? So I'm going to show you what the DNA results are in 20 people with autism in the last 7.5 months. what really is the underlying genetic cause of their autism. The treatments need to reflect what the real cause is. So in
Okay.
some cases, it's not individualized. It's like, well, what causes autism? What can you do about that? How can you put that in a treatment? But there's also individualized treatments on top of that to find out what the exact cause of autism is in that individual and what can you do differently about that that you wouldn't necessarily do in somebody else. So yeah, the treatment is based upon what causes it. You need to know the diagnosis to understand how to treat it. So I am going to be going through some data, and nobody has ever seen this data before. You guys are the first ones ever to see it. I've never had this presentation before. I actually spent the last weekend putting this data together, and the last few days I'm polishing it. So this is new data on autism, and then I'm going to translate that into how to treat it.
Well, and I wanted to add a note how it is so important to have some genetic testing done, because I would see a lot in the autism community that, as a mom, you would see another mom's child and say they were doing amazing on a new supplement that they just tried. And so, of course, they're like, oh, well, if this kid's doing amazing, I'm going to try it for my kid. And they would have, either no results or, the child would start doing, badly. And it's so important to realize that, as I always said, my kid is not your kid. And the genetics kind of lay a blueprint for, what one child would do well with and another will not. So it's so very important,
Exactly.
I think, to get this information.
So I'm going to be talking about 20 individuals with autism. They have other things as well, but what they all have in common is they had a diagnosis of autism, that they had the whole genome, all of the DNA sequenced in the trio. That's mother, father, and the patient. And it was all done at Variantix, which is a lab that is in the Boston area that I use frequently because I think they do the best work. And they do take insurance, and I think that they're easy to work with. And this is all in this year so far, since the last major update to the software. So 20 patients, unrelated to each other. Some of them had affected siblings, but I'm not counting those as separate. So 20 patients have found the cause of disease. Causal, that means that the genetic cause can be said to be the major cause of disease, not just a contributing factor, but the cause of disease in 14. So in 14, 70% found a cause, and 30% I didn't find a single cause. So of those 14, 7 of them, the cause was labeled by the laboratory, on the laboratory report. That was put in there. Either they said, well, this is what we think it is, or this is one of the many variants we found for the doctor to look at. But 7 of them, 35% of the patients, the laboratory identified what I think is the cause. But in another 35%, the other half of the 70%, the abnormality was not on the laboratory report. It was found when I looked at the sequences, and I look at the raw data of the sequence, not just the report.
So how does this stack up with what other doctors or researchers are finding?
Well, the 35% is about 1 in 3. That's about what major researchers are finding in major academic centers. When they sequence all of the DNA, they're finding about 1 in 3 diagnoses. I'm finding about double that because of going beyond that and looking at the raw data that the people look at to make the report.
Okay.
So, I mean, one thing is that, well, okay, you found it in 70%, but are there some people that are more likely or less likely to find it? Well, yeah, I mean, if you divide it into moderate intellectual disability or more problems versus mild or less problems. And that's really important because, I mean, people that have a normal IQ or near normal learning disabilities or maybe mild intellectual disability, those people for the most part are out in society. They often have jobs, they live alone, they may be married, they may have children. But when you start getting to moderate intellectual disability, those things become very difficult to do. And when you get to severe, they become impossible. So if you had to draw the line somewhere, that's where I usually draw it. So 12 out of the 20 had more severe intellectual disability, from profound to moderate. An exact diagnosis is made 11 out of 12, or 92%. While the other 8 had mild to normal IQ, a diagnosis is made 3 out of 8, or 38%. And this is statistically significant. There is a difference between those two. So 3 out of 8 is not bad. So still, with people with the lesser degrees of intellectual disability, you can still make diagnoses, but the likelihood of making an exact diagnosis is going to be less. And if you're on the more severe side, it's going to be extremely high. Now, these people have genetic findings. I'll show you in another slide, and that often translates to therapy, but they don't have a single genetic cause. The other thing is that if you have tics, the chance of finding an exact genetic cause was only 2 out of 6, or 1 in 3. And if you don't have tics, it was 12 out of 14. Because tics sort of mean immunological problems, pandas type thing, and it's more immunological and less likely to have an underlying genetic cause. And those are also statistically significant. So let me go to the next one here.
Before you continue on,
yeah.
Kimberly, are there any questions in the chat that on those so far what we've discussed?
Not a question, but I had a parent who said, my son is almost 5 years and has mild autism and will be starting his spectrum needs medication today. Oh, wait, hold on. There is a question. Should he be taking it with Q needs? This would probably be better to answer at the end of the presentation.
Yes, and we'll discuss it later.
Yeah,
Okay.
but it's a good question, and we will get back to that.
Yeah.
All right.
Okay. So these are 10 of them were de novo. De novo means it was not in the parents. We had both mother and father. The mutation was not in that. It was only in the person with autism. So 10 out of the 20 are de novo mutations. And that's why it's really important to sequence the parents as well, because that is half of them had a de novo mutation that I believe is the cause of the disease. And then 10 out of the 14 had de novo and 4 were inherited. Now, I know this is a complicated slide, but the thing I want to show you is that all of the colors are treatable pathways. The red is involved in oxidative stress. The blue is amino acid metabolism. The green is in ubiquinization, which is in the protein turnover. You're getting rid of old proteins. And these are channels for salts with a positive charge, so salt channels or ion channels. These are all treatable. So you can see that there's one here. This was very important to make the diagnosis, I'll get to later, but it's not necessarily treatable. And there are 2 here in gray that involve genetic machinery that we really can't treat with current technology. But the vast majority of these diagnoses are treatable, and I have recommend treatment for these patients.
All right. So Dr. Boles, you said of the 20, you found 14. You found a direct genetic
Cause is 14. Yeah.
A cause on 14 of the 20. And you said that they're treatable pathways.
Right.
How do you treat them?
Well, let me get to that later.
I'm getting ahead of you. Okay,
yeah, sorry,
ahead.
you're getting ahead of me. So right here, remember that I said that of the 70%, half of them, the lab made the diagnosis or found what they thought may be one of the diagnoses, and half of them were not on the report from the laboratory.
Yep.
So the question is did they miss it? Why is that?
Yeah, what happened to those other 6?
Well, one of them, this is the one I said is not really treatable from the last slide, but it's really important because in this disease, the collagen, which is the main structural protein, is weak. And the collagen genes usually cause like an Ehlers-Danlos syndrome, but collagen 4A1 is an exception. This is the collagen in the capillaries, the little tiny blood vessels in the tissues. They burst and you get tiny little microhemorrhages, micro bleeds all over the body, including in the brain. And that can cause autism. But these kids, if they get a head injury, they get a lot of brain bleeds, and they're usually not diagnosed until later after they've had significant brain bleeds and they're extremely mentally retarded. So this kid needs a helmet and not to get involved in anything with the contact sport and everything to try to protect that, to avoid that from happening. So even though I can't treat the capillaries, this obviously makes a big difference in the treatment. But this is an atypical presentation because this is something different from what people think about with collagen genes. So I think the lab just simply missed this one. So what about the other 6? Well, two of them are extremely rare disorders. One of them was 4 families have been reported in all of the world literature, and one of them only 2 individuals have been reported. So these are extremely rare. The lab is not necessarily going through case reports of what has been seen once or twice in the world before. And then 4 of them are new disorders. They've never been seen before. This is the first case ever. So the lab isn't looking for new disorders, but I am. So, I mean, a question that I often get at this point is, well, if it's a new disorder, well, how do you know that? Well, these were all de novo. They were not present in either parent. De novo mutations are very frequently the cause of disease. I mean, to give you an example, there's 40,000 inherited variants in each person on the average, but there's less than 1 on the average de novo variant that changes the genetic code. So when we see it, it's usually the cause of disease, but not 100%, but it usually is. Of these 4 genes, all 4 of them are genes that researchers have been looking at that they might be involved in autism. They've all, even though nobody has found a case in those genes, they're all genes that people have been looking at. And 2 of the genes, there are variants in that gene that are statistically associated with autism. So those are variants that increase the chance of autism not causing. So these 4 that are new disorders, I'm very convinced that they are indeed the new cause of disease. And all 4 of these are treatable, by the way.
Okay.
Okay. So this is, you said, well, what about the other 6?
Yeah.
You found it in 14. Well, 4 of the other 6, I think that we found a cause, but it's not the only cause. It's a contributing factor, and I have those in red. So it's actually 14 out of 20 found the cause, and of the other 6, 4 of them, I think that they probably found a contributing to. So it's really 80%. So the diagnoses is really 90%. When you add these 4 with the other 14, you get 18 out of 20. So putting it all together, and 16 out of the 20 cases, I made a treatment recommendation based upon what the DNA showed. So this is an individual treatment recommendation based upon what the DNA showed in that child. Well, what about the other 4 cases? Well, those I think are more susceptible PANS, autoimmune disorders, and I sent them to the immunologist for workup and treatment.
So I guess what we can conclude here is you're using the latest in science to determine the cause of autism, and then you're making your treatment recommendations based on that. And on 80% of them, you are giving this individual a good treatment recommendation that's going to positively impact their life.
Every single one is getting treatment recommendations based upon what usually causes autism. But these 80% are getting an additional on top of that treatment recommendation for what's causing autism in their child.
Okay.
Yes.
Thank you.
I'm just going to give a couple other case reports quickly so that you can kind of see how this kind of plays out in some cases. There is one child here, has autism, absent speech, more on the severe side. Found a gene variant in both parents. This is involved in protein turnover. And so this child has homozygous, or 2 copies, one from each parent. And treatment didn't work on it. But this child had a really weird sleep disorder. Every 3 weeks for 4 days, he would be awake between 2 and 5 a.m. Both parents were busy professionals that are working full time, and this was extremely disruptive for them. An additional genetic finding was involved in one of the genes that makes melatonin. And so I put the child on very low dose melatonin, and the sleep completely normalized. So it's to show you that even if the exact molecular diagnosis is not treatable, and there are cases that have that, sometimes you can find other genetic disorders that make an impact on the child.
Okay.
Ion channels, that's moving things back and forth across the membrane. I want to just do really quickly. A 12-year-old, high-functioning autism. He was in all normal classes and doing very well. He would have crashes, 3 to 6 per month, in which he couldn't go to school. The crashes would last for a couple days, and so he missed about half of the school. And
Now, what do you mean by crashes?
oh, would be in bed, completely bedridden. I mean, just very pain, fatigue, nausea, just be completely out and unable to really even hard to use the restroom, and would be a normal kid between those crashes. They thought it was a conversion disorder. They thought it was psychiatric and that he was doing it because he wanted to get out of school. But we found a mutation in the mitochondrial DNA as well as a calcium channel, put him on treatment, and the treatment was mostly supplements. And on the supplements, the problems went away completely and he went back to school.
Amazing.
Another one here presented as a teenager, autism, migraine, other problems, chronic fatigue. Got better on the mitochondrial cocktail, but this is the cocktail I was using at that time about 15 years ago or so. Only got so much better, still had such bad autism, would never leave the house and would never talk to anybody. But then when I did the genetics, I found that the problem is in this gene right here. So I said, well, what if we give alpha-ketoglutarate? Alpha-ketoglutarate, you can get that over the counter, you can get that on the internet, but it's not one of the things I thought about using. And probably if I were to use 20 other things, it probably wouldn't have been one of the 20. But because of the genetics, I used this and she got dramatically better. So what this case shows is that even if you do take the cocktail and you take it a la carte, and let's say you take 6 or 10 or even 15 components of the mitochondrial cocktail separately, you may miss the one. And I have other case reports that I could show you that I don't have time today to that it's individualized and that you really need to take all of it because you don't know which one it will be in your kid. So and then the different pathways kind of spell out autism here, is sort of cute, but it's with all of these different pathways, many of them have involvement in more than one gene and more than one pathway. And just because that autism is highly genetic doesn't mean that environment is not important. Environment is what turns genes on and off. And environment is how we treat these disorders. All of the treatments are basically altering the environment. They're not altering the genetics. They're altering the way that the genes express, even if we can't change the genetic code. So just because autism is mostly genetic, doesn't mean that it can't be treated.
Okay.
And so you can say, well, if these genes are affecting the brain and they're causing autism because they're genes that affect brain function, they should affect other parts of the brain as well. And they do, and most of the patients do have other things. And this is important because these are treated differently. And we had spoken about de novo variants, and that's about half of them. And it really is, this kind of autism and that kind of autism are really different in many ways. This one has de novo variants and this one has inherited variants. But the main difference is that this one's not going to reoccur. It's less than 1% that future siblings are going to have it. Well, this one is as high as 50% that another child will have it in the family. So it's another advantage of genetic testing. Okay, so this talk is on supplements. I wanted to show you what the genetics of autism was so you can understand why I choose the supplements and why I made the supplements that I do. So here are the 6 common treatable pathways in autism. And different supplements treat all 6 of those pathways. But diet and medication are also important as well, not in all of them, but in many of them. But the point to show here is that there are multiple pathways which are very common in autism in general, and that supplements are really the mainstay of therapy for all of them. And it is the main one for 5 out of the 6, with ion channel medications being slightly more important.
Yeah, so, I don't want to belabor this, but if it appears as though supplements are the key component to treatment for individuals with autism. So why not put all your, patients that present with autism or autistic features on the mitochondrial cocktail?
Well, that's what I do. That's what I do in my own practice. Yeah, exactly. So putting things together into combination. Some people cannot tolerate the combinations for whatever reason because there's something in there that they can't take. But I'd say over 80%, 90% of people can tolerate the combination supplements very well. And the advantages of a combination is it's easy to use. You're not buying and using a whole bunch of different ones. I realize that giving 20 different supplements to a child is really hard, particularly a child with autism. It's cheaper to buy a combination than individuals, and you get less filler. Instead of having all the fillers for 20 different products, 30 different products, you have just a filler for one product. So there's major advantages. But what are the considerations? Can you swallow? If you can swallow, the supplements are a little bit cheaper and you can get a little bit more dosing in it if you can swallow. But not everyone can swallow, and the first one I made, Spectrum Needs, is made in a powder with the understanding that there's a lot of kids out there and older people that really want to take it in a powder form. The other thing is the taste. If they won't take it, they can't benefit from it. And so the taste, when we made Spectrum Needs, we were very careful to make sure that we went for multiple tastings and everything, and we tried to make it something, and the vast majority of kids do like the taste of these products. So that's what the advantage is here. The next question is okay, so you take the combination product, and there's ones that we make, and then we have a competitor that also makes the products. And is that everything? If you just take that one product, is it everything? Well, I wish that it was, but the products, these are powders. Either you take the powder directly and you mix it with whatever beverage you want, or the powder is in the capsule. And oils don't really mix with the powder very well. You just can't get it into the bloodstream by doing that. So there are a couple of things that you really need to do separately. It's just it's physics, the property. One of them is coenzyme Q10. Ubiquinol is the important type of coenzyme Q10. That's a really important one. That's something to remember. If it doesn't say OL at the end, I really recommend not taking it. The other one says ONE at the end, so it spells none, N-O-N-E. That's it. You don't want to take the none, you want to take the null. And then there's swallowing, and there's liquid versus gel capsules. If you can get gel capsules, that's much better, much cheaper. CoQ just tastes bad inherently, so it's better if you can swallow it. The other one are the omega-3s. People think about that as fish oil, and fish oil is an excellent way to get omega-3s. You can get them for the high premium products. You can get very high doses of fish oil, very high doses of omega-3s like DHA and EPA. That's great for cardiac health. It's great for insulin resistance. It's good for blood pressure. It's good for your kidneys, for your hair, your skin, your nails. Fish oils really has good overall health, but it doesn't go directly into the brain. These high doses go into the other organ systems. They cannot enter the brain. They have to be converted, and the high doses don't get there. So some of the products that are designed for people with brain disorders have krill oil in it. Krill oil has phospholipids in it, so it goes directly into the brain. These products are important for like autism, ADHD, other brain disorders, but they don't give you the overall general health that you get from fish oils because the dosing's much less because of price. So I recommend that people take both of those, fish oil and krill oil, either in a combination product or two different products. And then, of course, swallowing is another issue. Fish oil and krill oil are not the best tasting. So if you can take a capsule, that is better. So these are my recommendations, and these are based upon the science and the latest science. How do you treat autism? This is a general recommendations, and then at the bottom, each person's an individual. You have to consider their own genetics, their own situation. I recommend a high-powered mitochondrial cocktail that has vitamins, minerals, antioxidants, etc. The dose is based on the patient's weight. That's on the label and on the websites. I check blood levels for carnitine and 25-hydroxy vitamin D, and then I increase the supplements of those directly if they're low. Sometimes they are. And then Neuroneeds, this is going by, has Spectrum Needs, which is in a powder, comes in lemon and berry, and then Energy Needs, which is a similar product, which is capsules. I recommend to take a ubiquinol product, a CoQ. This is for adolescents and adults. I recommend 200 in the morning, 200 in the evening, and that's a starting one. You really need to get blood levels. Like for kindergartners, I use 100 and 100, and for in between, like a fifth grader or something, I often do 200 in the morning, 100 in the evening. But these are starting doses, and you need to get blood levels, and not ubiquinol is they're not all the same. There are different bioavailabilities even in the ubiquinol products. We sell Q-Needs, which is a very high bioavailability product in small soft gels. The other one's essential fatty acid, krill oil for brain health, and then fish oil for the rest. You can take separate supplements, and until we put together a combination, that's what my affected child took, and that's what I was taking for health. I was taking the fish, he was taking the fish and the krill, but now we both take a combination. We just came out with Omega Needs within the last month, and it combines fish oil and krill oil together with sunflower seed oil for additional phosphatidylserine. So this is what I recommend as a general. This combination will hit the mitochondrial cocktails, it hits the neurotransmitters to some degree, it hits the calcium channels, it hits the major areas. Of course, each person is an individual. I do genetic testing and then treating the underlying genetic cause in each individual with these on top of it for everybody. And then some people, based upon the phenotype, if they have really bad migraines, you might want to increase the B2, which is riboflavin. Or if they have really bad constipation, you might want to add additional magnesium, etc. So each person is individually, they're an individual in terms of their genetics, they're an individual in terms of their symptoms. If they have a lot of hyperactivity or trouble sleeping, anxiety, these issues, these are often neurotransmitter related. And then I recommend a neurotransmitter cocktail. Now, these things were not added to the multivitamin cocktail because not everyone needs or wants those. These are to try to slow down the excitatory neurotransmitters, but mostly they're to speed up the inhibitory neurotransmitters. And this cocktail here with GABA, theanine, 5-hydroxytryptophan, magnesium, and vitamin B6 is my inhibitory neurotransmitter cocktail. We sell this as Calm Needs if you're interested. And I use that for anxiety, hyperactivity, or nausea. I'm sorry, or insomnia. So another question I get, well, diet and supplements. You're talking a lot about supplements. What about diet? Diet's important too. But you can eat the entire salad bar of an entire restaurant and go next door and eat the entire salad bar and not get the doses that you can put in here. But you can get things in food that are important, and obviously to avoid other things in food that you don't want. I mean, this is a talk on supplements, but that's not to say that diet is not important. And again, I mean, I can't say this enough times. These recommendations are general. They're not meant to circumvent or contradict your physician's advice. And that all recommended treatments you should discuss them with your physician. Don't let these old ladies bother you. Don't worry about the fact that if you find your genetics, you're going to figure something out that you can't treat. Regardless of what the genetics are, these are the things that are highly likely to help. But if you find the genetic cause, which is more likely than not, that is likely to be treatable by itself on top of it. So know the cards in your hand. You can't get a new deck, but at least play your hand to the fullest potential. And I realize that a lot of this stuff is not what every physician is used to hearing, and you may have trouble getting your physicians on board. If you talk to your physician doesn't want to do genetic sequencing, or your physician doesn't want to recommend these products and tells you not to, and you should obviously listen to your physician's advice and everything. If you want your physician to talk to me, I can talk up to 30 minutes by Zoom with your physician to talk about genetic testing or these products or anything else they may want to have about this area. And this is the exact link for the physician to put in there. By the way, these slides will be available, so you'll be able to copy that down later. You don't have to get that really quickly. This is a NeuroNeeds website if you're interested, and I wrote literally several hundred pages of information on there that if you want an article on genetic testing and autism to give to your physician, this is the exact link for your physician to do that. And if you're interested in having me to be the physician and you want me to recommend testing or recommend treatment, this tells you about the practice and gives you the links so that you can get to the coordinator, Lori, and that can help you along your way. So with that, I'll leave this up. And then are there any questions?
Yeah, we had a few comments. One is the one I was reading a little earlier. This lady has a son who's 5 years old and has mild autism, and she's starting him on spectrum needs. Her question is, should he be taking it with Q needs and omega needs, or will spectrum needs just suffice? And I think we just kind of went over that.
Yes.
Um,
Spectrum
I mean,
needs or energy needs if you can swallow. Q needs and omega needs. Yes, that is what I recommend for any neurodevelopmental disorder. Autism, significant ADHD. I mean, I use it, intellectual disability, epilepsy, etc.
And would you also recommend that it would probably be a more conservative approach to maybe start one at a time, one supplement at a time?
Oh, no, excellent question. It's always good to start one at a time, and it's always good to start at a lower dose. So the dose for an adult is 3 scoops in the morning, 3 scoops in the evening. For a school-age child, like a second grader, sixth grader, etc., it's usually 2 scoops in the morning, 2 scoops in the evening. And it's by weight and it's on the container. But I don't start with that. I start low. Start with half a scoop or 1 scoop twice a day, and then when you work your way up over a week to 2 weeks. If your kid is really sensitive to things, make sure you take it with a meal and work it up slowly. If your kid's not really sensitive to it, you can even start at half the dose and work up. But
I
yes,
know my son, when we would start him on some supplements, initially he would be more hyper. And then and we'd always start slow, and then slowly the hyperness would dissipate as his body adjusted.
by giving it with a meal, it's absorbed slower, and by starting off lower, you get the body used to it. There are some kids that will get hyper no matter what you do on the supplements. Those are less than 10%. Some of them, the lesser dose is better. Some of them, putting calm needs on top of that orients it, because the excitation for making the mitochondria make more energy, and then you kind of use the neurotransmitters to kind of dial it back. And then, this is not sedating, by the way. You can drive or whatever on that. These are just to kind of calm you down a little bit, mellow you out, but they're not sedating. So there are different ways to do that. But usually there's no side effects if you start low. Start low, go slow. Take it with a meal.
Okay, so Alyssa asks, she says, my 7-year-old daughter is on the spectrum. She takes spectrum needs for mito dysfunction. It's hard to get the full dose in. Any recommendations?
How old's the child?
7.
Some 7-year-olds can swallow, not all. Usually by the time they get to about 10 or 11, I suggest, they should all be swallowing. Some 7-year-olds are champs at this. You can train them by giving them tiny little things to swallow, like little gumdrops that you cut into little pieces, so it's not a big deal if it gets caught. The other thing is, for the berry flavored, it goes really good into grape juice or apple juice. And for the lemon flavored, it goes really well into like pineapple juice or orange juice or lemonade. There are many different things, and make it cold. Put it in the fridge or add ice to it. Some people put it in smoothies. I've heard people put it in chocolate milk before.
You could also make it as a slushie.
Slushies, yeah. Different people.
With
Some
ice
people
crust.
made it into popsicles, but I mean that you have to take the whole thing. And then there's some people that just take it and put it in a couple teaspoons of water, so it's really, really, really concentrated, and put it in a syringe and just squirt it down, and then you chase it with whatever they like.
Another question. Will you be talking about this subject at the TACA conference this fall?
I took half of these slides from the TACA conference. Yes, the TACA is going to get the hour-long presentation instead of the 30-minute one.
Okay, another question. My child is 6 years and on the spectrum and has suspected CVS. What would you recommend supplement-wise to help with the CVS?
I have a lot of kids with autism and CVS, and it sounds really weird, but that's how I got involved in autism, is because I was doing CVS for a decade, and like all their brothers had autism of all of my patients. And it's like I realized the genetics overlapped, and then I started getting more and more involved in autism, and that became my second focus. So the treatments are really the same. It would be, energy needs for most.
There is a site dedicated to cyclic vomiting syndrome, and there's a lot of good information and videos and links to medical research studies, of which I would strongly recommend. I speak with patients with cyclic vomiting syndrome every day, and they are so pleased with the energy needs bundle. The booster bundle seems to be working very well for them. So that's for patients that can swallow. I hear it every day. And we have testimonials on our website about how the episodes have come to an end on most of these patients. So that is a great. We have a lot of great testimonials when it comes to cyclic vomiting syndrome.
Okay, another question. Is there a promo code that they can use? The back to school promo code, correct?
Yep. Kimberly, do you want to talk about that one? Yeah, go ahead.
It's a promo code SCHOOL, and it will get you, let me just refer to this, was it 10%?
10% off your
10%
purchase,
off.
and it's going to be available through September 30.
I mean, school, like SCHOOL? All
Yep.
lowercase?
Yes.
Okay.
Yeah. Let's see, another question. Do these medications work for tremors and Parkinson's? This is for my 65-year-old dad.
My 86-year-old mother is on this, so and she does great on my formula. She actually prefers the to take the spectrum needs. So it's not the age is the issue. A lot of Parkinson's is mitochondrial or mitochondrial in part, and it might help. I'm a pediatrician, and I just don't have a lot of experience in this. It might help. It certainly might help with the physical fatigue, the muscle weakness that comes with aging.
So we have individuals here with here at NeuroNeeds with their parents. My 87-year-old father, my 84-year-old mother. They both take spectrum needs. They drink the liquid, doing very well, and their blood work. Their doctors ask them all the time what they're doing right.
Great.
So.
Let's see. Is it true until we help the mitochondria that we won't be able to fully tackle things like mold that she's dealing with? I guess.
It's mold. The vast majority of people have no trouble with mold. There are people that have allergic reactions to mold, and it's sort of like there are people that if they have a bee sting, they'll go crazy and they might even die from a bee sting. So I'm not just saying that mold's not a problem. For some people, mold can be a serious problem that can set off an immune response, sort of like a bee sting can. It's very complicated. Some of those people do have a mitochondrial component, and they get a little bit better on the treatment, but certainly that alone is not going to, these products are not going to make you all the way better. But there are some patients I have that have MCAS-like issues, mast cell problems, and there are some improvements on that because a lot of those patients will have mast cell problems and channelopathy, or mast cell problems and an autoinflammatory disorder. And so I treat the channelopathies and I send them to immunologists to treat the autoinflammatory disorder. So it's complicated. And genetics, when you do the whole genome, you get all of the genetics, including the autoimmune disease genes as well.
So probably we have time for one more question. And as always, this is going to be up for, forever. So if there are questions that we didn't get to, you can type them in the chat or the comments, and I will get back to you.
Furthermore, Kimberly, if there are questions, if someone's watching this recording, you can go to neuroneeds.com, click on the contact page, and send your inquiry in to us, and we will get back with you from there if it's at a later date.
Okay. So the last question, can I give Spectrum Needs powder first thing in the morning on an empty stomach in my son's smoothie, or does it have to be in the afternoon only?
Most of my patients take it when they get up and when they go to bed, but it can be at any time. I have ones that take it when they get home from school because they don't like to take it in the morning, they forget, and when they go to bed. It can be taken, it's good to separate them out, by several hours so that you can get the advantage of not having two doses right quick together and have like 22 hours different, and also for bioavailability so that the intestine can then empty and then you can do it again. But you can really take it any 2 times you want.
Dr. Boles, can you just elaborate? Part of that question was with food.
Yeah, okay. Most people can take it without a meal and they have no trouble at all. Some people, where they take it outside of a meal, get nausea and they need to take it with a meal. If you take it by itself and you get no nausea, no problem. I mean, if you get nausea when you take it outside of a meal, obviously take it with a meal. But the smoothie kind of is a meal, that might be enough.
Mhm.
I do recommend everyone takes it with a meal when they're getting used to it. But after a couple of weeks, you want to skip the meal, see what happens? Most people do that and they are fine.
Mhm. All right. Well, thank you everybody for who joined us. And as I said, you can leave comments below and we will get back to them. And is there anything else Chris or Dr. Boles would like to add?
Yeah, just in closing, for those that need more information, you can go to neuroneeds.com. We have a learn page with a lot of information and links to medical research. And we also have a medical conditions page with a lot of video information and links to medical research. Also, don't forget that we are running a sale, a back to school sale with 10% off your purchase now through September 30. The discount code is the word school. And that should, it's pretty easy to use that discount code at checkout.
And I just want to say one thing. I know that this is heavily laced with science and everything, but I just want to emphasize that I'm a physician and a scientist, and I base the treatments and I recommend the treatments for my own patients and also for others based on the latest science. And I just wanted to make that known that this is what we do, why we do it, how we do it.
Yes. All right.
Righty.
Well, thank you again, Dr. Boles, for your extensive wisdom, and we look forward to your next talk next month.
Thank you.
Okay.
Thank you. Bye-bye now.